New data suggesting Texas's COVID-19 peak may come sooner than first thought. But one infectious disease expert says you should not really count on that. Jason Miles shows us how the numbers are changing daily.
Last week, experts said the peak here would happen likely in early May. Now, new data suggests it could be April 19th or 20th. Dr. Peter Hotez of the Baylor College of Medicine looked up the latest COVID-19 tracking data as we spoke via video chat.
So it was early May, and now moved it towards the end of April. So later than the national peak, but earlier than it was.
He's talking about projections compiled by the University of Washington's Institute for Health Metrics and Evaluation, which shows the national peak occurring on April 15th. If you select Texas on the database, you can see that it shows the peak here happening 4 days later on the 19th, not on May 5th, as Hotez suggested last week.
I mean, what they're now doing is they're trying to update the model as new information comes in, and this has been one of the problems, with the models, and that they're only good as the assumptions.
They're also based on available statistics based on patients who've either been admitted for treatment or positively tested for the disease. And it doesn't break down different areas in huge states like Texas.
To think that the epidemic is going to look identical in El Paso as it does in Houston is probably not the case. Our demographics are different. Our location.
Whether it's late April or early May, Hotez says it doesn't negate the importance of aggressive social distancing in order to reduce demand on our healthcare system. And continual reassessment remains his prognosis.
And then we'll have to see where we are at April 30th. Ideally, we'll be coming on the way downward if that April 20th projection is true. But it could change again, depending on new information.
I checked with Harris County public health officials. They are not willing to pinpoint an exact date for a potential peak here, but continue to stress the importance of those preventive measures. Back to you.